All right. Thank you everyone for joining us. Again, this is the Mountain Pacific VaxFax open office hours to discuss immunization rates in the Mountain Pacific region around COVID-19, pneumococcal, and influenza vaccinations. My name is Stevie Tsai. I am a pharmacist that works at Mountain Pacific Quality Health and will be helping out in this series. And today I am joined by my colleague, Kyla Newland, who is also a registered pharmacist. Today's content, we're going to focus on news and updates around the vaccines. Today's we will talk about different rates of those vaccinations in our states and territories. As a reminder, the Mountain Pacific region includes Alaska, Hawaii, Montana, and Wyoming, as well as the Pacific territories of American Samoa, the Commonwealth Northern Marianas Islands, and Guam. Thank you all for joining us. Today's discussion is going to center around how to make a strong vaccine recommendation, and Kyla will be bringing us lots of tools and tricks to talk to people about vaccines with confidence in a way that we can get them to then want that vaccine in that moment of care. We'll also follow that up with open discussion. We're hoping that these open office hours can include a lot of sharing of tips and tricks to improve vaccines in our practices, as well as talking about barriers and brainstorming ways to overcome those. We do have one poll to get us started here. If we could bring up the poll now, please. And we're just curious, I want to know what you think the rate is for the COVID-19 vaccine uptake for eligible populations in that Mountain Pacific region. So this would include people over the age of 16 who can get one of the 3 emergency use authorized vaccines. Please go ahead and pick one, make your selection. Mainnet, whenever it looks like a good stopping point, feel free to cut that off and we can move on to the next one. Perfect. So it looks like most people, about 33%, say between 20 and 40% of people are wanting and accepting that COVID-19 vaccine. If we can move to the next question, please. So same question, now I'm curious, what do you think the influenza vaccine uptake is? This is specific for Medicare beneficiaries, so those people over the age of 65, or those that qualify through disability or end-stage renal disease. How many of those people do you anticipate are willing to get their influenza vaccine every year? All right, and it looks like about 42% of our audience says 40 to 60% of people get that annual flu vaccine. And then our last poll here, please. So same question, now I'm curious, for the pneumococcal vaccine, what do you think the uptake rate is for Medicare beneficiaries in our region? All right, and here we have 46% of participants think that rate is somewhere between 20 and 40% acceptance, and then 38% says 40 to 60%. So somewhere between 20 and 60% is our best guess as audience members. Thank you for participating there. As we move forward, just a reminder, we do have the question and answer available to you if you have anything that comes up while we go through, and then at the end we will move to that open discussion. So when we look at the data on our vaccine rates, there are some things here that surprised me when I looked at them. I'll be curious to hear if any of you find any of this surprising. When we look at the number of people that have completed their COVID-19 series, we do see that your guesses were pretty accurate there. we have, depending on the age range we're measuring, between 25 and upwards of 60 to 70% of the population that has gotten that vaccine. It is more accepted in those people over the age of 65. So when we can measure that group, we do see more of them are wanting and getting that vaccine and have completed the series. Alaska is definitely leading the charge for much of the nation there. So kudos to Alaska. Hopefully we can get some good sharing to see what's going well in their COVID-19 vaccines there. When we look at pneumococcal, I'd be curious to know if this surprises anyone. This is for newly eligible beneficiaries, just in a 5-year snapshot. We found that our rates typically are below that 22%. We're really not vaccinating people that are newly eligible for pneumococcal disease vaccines quickly at all in our region. That means we're leaving a lot of people vulnerable to invasive pneumococcal, and they're not getting protected in a quick fashion. This is a vaccine where it's important to vaccinate as close to 65 as we can. We know we get the best immune response when we give it younger. And so there's a lot of potential to change that number. And then influenza is another one where those rates are lower than perhaps they should be. We are able to look specifically at those 65 and older, those people who are most at risk for influenza complications, such as hospitalization and death. This is from the 2019-2020 season, which is a pretty average flu season when we look back over a decade. So these are pretty standard rates for what we can expect for pneumococcal acceptance annually. And again, we're leaving a large percentage of our population vulnerable to those diseases. So plenty to think about there, and that's why we're gathering together now so that we can really work on those rates. We plan to focus on COVID-19 and pneumococcal as we move into the summer. And then obviously once influenza season comes around and we're vaccinating in the fall, Mountain Pacific plans to ramp up our support for those vaccines then. So please feel free to reach out to us if you're curious about these rates or if there's any way we can assist you. And with that, I'm going to pass it over to you, Kyla.
Thank you, Stevie. I was pretty surprised at the pneumococcal rates myself, just never really looking at the data specifically, but assuming that it would be higher than it is. So we've definitely got some work to do. Next slide, please. So I took a look at a recent survey, and this was a survey of 200 primary care providers and nurse practitioners. And they were looking specifically at Medicare beneficiaries in their annual wellness visit to see how providers were approaching vaccinations and how much of a priority they were making them during these visits. And as you guys probably already know, this is something that each Medicare beneficiary is eligible to have annually. And actually only 2% of these providers said that vaccines were a priority during this visit, which is so low. And only 20% discussed if Medicare covered vaccines. So it definitely was not one of the priorities for these providers during these visits. Basically, it was put on by the Alliance for Aging Research, and they were just, looking at how well providers were incorporating this into this particular type of visit, but this could also go into other primary care visits as well. Next slide, please. So the same survey looked at what providers thought barriers for their patients were to getting vaccinated. And right up at the top of the list, we had fear of adverse reactions and fear of side effects like pain, which both of those are kind of the same thing to me when you think about it. Also, belief that vaccines actually can cause what they're trying to prevent. So just some misconceptions there that we might be able to better educate our patients about. Cost of vaccines. So this shouldn't really be a barrier for many patients. The only time that I've seen, because of the legislation with the Affordable Care Act, where vaccines are preventative medicine, and so they should be covered 100%. The only exception that I've seen to this is with the shingles vaccine, which in the Medicare system is covered under Part D. And sometimes patients will have a copay with that one. But the influenza and the pneumococcal vaccines should be covered 100% on Medicare and most other plans if a patient is eligible for those vaccines. But their perception was still that this could be a barrier for their patients. And then thinking that vaccines could be harmful. So all of these had a pretty high percentage of providers believing that these could be barriers for their patients. Next slide, please. Another thing that was very interesting that they found is that a lot of the providers don't even carry some of the vaccines that they might be recommending. And so this might make it a lot harder for patients to actually get the vaccine because they're going to have to access care in 2 different environments to actually receive the vaccine. If they're already at their doctor's office and they carry it, great. But if they don't have it and they have to make an extra trip to the pharmacy, that could be a barrier. And so there was a pretty high percentage of providers that don't even carry flu vaccine or pneumonia vaccine. So another thing for us to consider, and something that we might be able to help our patients out with, is locating maybe pharmacies or other places in your communities that do carry the vaccine so that they can easily access the vaccines if they can't get it at their primary care provider. Next slide, please. So they also looked at what information are providers lacking and what do they need more information on. And they say they need more educational materials. They would also like standard vaccines and diseases they prevent, how many people experience side effects, the risks of not getting vaccinated, information on what's covered by Medicare and what's not covered by Medicare. And this was specific to Medicare beneficiaries. So, you know, this could reach into some other payer sources as well. Just maybe some misconceptions or some barriers and lack of education in vaccine and coverage by third-party payers. Benefits of vaccines, dispelling myths and misconceptions. And then, as I kind of alluded to earlier, maybe the location of pharmacies and other providers in their area that offer vaccines. Next slide, please. So this slide has a nice presentation that kind of encompasses all that information that I just went over and has a lot more details if you want to go there and find more information. And then there was another campaign that I found that was called the Best Shot campaign that has a lot of really good resources as well. They have short films with overviews of how vaccines work, some highlights of the importance of vaccines, common myths and misconception, some communication tools for healthcare professionals, and then just reminders of, for older adults, a lot of the materials that we'll see out there seem like they're targeted at pediatrics. And so this campaign specifically was looking at an older population, which I thought was good because the resources seem to be a little bit more sparse in that area. And then just a really good toolkit with a lot of information that you might be able to use with your patients. Next slide, please. So what we know is that people are more likely to get their flu vaccine if it's recommended to them. And we probably know that this is true with other vaccines as well, but the research has really focused a lot on flu vaccine. So we know that if we make strong recommendations, then our patients are more likely to get these vaccines. So how can we, next slide, please. How can we do better? So we can look at some of the components we use when we're recommending vaccines, and I have a nice acronym that you can use if that helps you go through that process. We can provide accurate and concise resources for our patients. We can make sure that we address questions that our patients have, and we can address issues like hesitancy or past experiences that might make them less likely to get a vaccine. Next slide, please. So this is a really good acronym that I found from the CDC. and it's share, and it basically gives you kind of all the highlights of the things that you need to cover with your patient to make these strong recommendations. So you can share increased risk with your patients, given their age, given their current health status, given their disease states. You can highlight positive experiences, either that you've had or that you've had in your practice, with reinforcing the benefits of vaccination. Or even you could highlight a negative experience if you've had a patient that's been extremely sick, been in the hospital with pneumonia, and it could have been prevented by potentially a pneumonia vaccine. You could highlight that to your patients as well. Make sure you address questions and respond to concerns that they have or previous experiences that they may have had with vaccines. And then make sure that they realize it's not just to protect them, but also for those around them, to protect them from getting sick. And then the potential costs of getting sick. So just reminding them, you may still get the disease, but your chances are a lot less if you get the vaccine. You may have a less severe case and have a lower chance of missing work or having to go to the hospital or have a more severe case of disease. Next slide. So I found this campaign from the CDC that I really like, and it's called How I Recommend, and there is a ton of videos, but I chose one that I wanted to show you guys today, just giving one provider's perspective on how they recommend vaccines.
The way we foster a culture of vaccination within our practice is that we really start with a signage as soon as a patient steps in through the door. We have signs everywhere, and we also have our staff repeating the importance of vaccinations across the organization. So for example, if the person is going to the pharmacy, both the pharmacy technician and the pharmacist are talking about the importance of vaccine and reminding patients to become vaccinated. Our dentist also has that same message, our nutrition counselor, our lab workers, and then us personally, the clinicians, are also talking about how we get vaccinated and how we want to prevent our patients from having any issues.
So I really like her perspective of creating this culture of vaccination with kind of everybody being on board and really having vaccination highlighted throughout your practice or your practice setting, so that patients kind of have that at the forefront of their mind. And then making a recommendation, not just offering it, but really backing what you're saying and telling the patient why you're recommending it. It can cause, some of these viruses can cause severe respiratory illness. You could end up in the hospital, and they can really reduce your chances of having those adverse effects. Next slide, please. So a couple other resources that I found for sharing with your patients. The aging research, the same people that did that study have a nice true and false questionnaire that might be something that you could have your patients do maybe at the beginning of their visit, that kind of gets to the root of maybe some misconceptions or questions they might have. So I thought that might be a good tool. And then there's also an online "What vaccines do you need?" questionnaire that you can have patients do, where it just asks them a series of questions to identify if they're a candidate for different vaccines based on their risk factors and their age and all of those things that we need to look at. Next slide, please. So answering patients' questions. one of the probably the most common questions that you're going to get from patients is going to be about adverse reactions. And really, the best way to respond is to let them know that this is really their immune system. This is something that we expect with a lot of vaccines. And usually side effects will be mild and clear up within a couple days. But just giving them a heads up that these can happen can really be beneficial so that they know what to expect. And then some of the most common adverse effects that we'll see is a local injection site reaction. So just explaining to them that this is something that's normal as well, and we see it with a fairly high percentage of vaccines. It's nothing really to get too worried about, and then it will clear up in a day or so. Some of the other things we'll see, fatigue, headache, nausea, low-grade fever. Those are pretty common kind of universal side effects that you see with a lot of vaccines. And then addressing some severe reactions as well. So if they have concerns about anaphylaxis, if they're worried about fainting or anything like that, let them know that that does happen in a certain percentage. The anaphylactic reactions are obviously very rare, but can happen. We know how to treat that. And the same with, it seems with COVID vaccine, I think a lot of people are more nervous about that than other vaccines. So a lot of times that will induce them to faint more easily. So just, being aware of that and letting them know that if that does happen, that we'll take care of them. Some people have concerns about preservatives in some of the vaccines. Most of the vaccines now don't have preservatives, but some of the flu vaccines still do have thimerosal in them, the multi-dose vial. And it's just in there to make sure that because we're sticking the needle in those vials multiple times, that they're safe to still inject in the patient. One of the other misconceptions out there is that some of the pediatric vaccines have thimerosal in them and that they can cause autism. They have actually been removed from all pediatric vaccines since 2001, so that's not any kind of a valid concern. And we know that thimerosal and other preservatives or other preservatives are not proven to cause autism either. Vaccines in pregnancy, if you have patients that you're talking to about that, a lot of vaccines, well, several vaccines are recommended during pregnancy because we know that some of the immunity can pass on to the baby, and that's a good thing. The only vaccines that we absolutely do not recommend in pregnancy are live vaccines. And so that's something that we can educate our patients about. And then getting multiple vaccines on one day, sometimes that's more of a pediatric concern as well. But if we are giving multiple vaccines to an adult on one day, for example, if we give the flu shot and the pneumonia shot at the same time, we do sometimes see a higher chance of those side effects just because we're activating the immune system kind of dually at one time. So letting patients know that, they might feel a little bit crummy, but it is certainly okay to administer the vaccines together. The thought is that if the patient is there to get vaccines on one day, the chances that they might not come back another day are there. And so we might as well vaccinate them together if we can. Now, saying that, there are some vaccines you cannot give together, and there is a waiting period between, for example, the COVID vaccine and other vaccines. So that's also a consideration. All right, I think we are going to move into a couple more polling questions, and then we're going to have time for some open discussion. So Maynette, if you could pull up the polling question, perfect. So we're wondering what educational materials you currently have in your practice. And given this, we will see what else we can provide in the remaining part of our series. All right, so it looks like COVID is going to be kind of the lowest of the three, but it looks like flu and pneumonia are pretty equal, with everybody having pretty good access to some resources. So as we continue the series, we would also like to know what else you would like to hear about related to vaccines. So if you could check all that apply on this question. Okay, so vaccine hesitancy coming out on the top, side effects, incentives. So those are kind of our top three. And we have 4 more sessions in this series. So we will definitely put those at the top of our list. And now I think we were going to go ahead and open up all the lines so that we could have kind of some open discussion on what your thoughts are on what we've talked about so far.
So you may notice that you are being promoted to panelist. So that means you will be able to absolutely unmute yourself, ask any questions you may have. You can also drop them in the chat box and we can answer them that way as well. I also, go ahead. I was just going to add that one of the things that we will be talking about during the next session is that vaccine hesitancy, and we will add in healthcare vaccine hesitancy as well. So I'm really happy to see that we are on the right path as we move down to our next session next time.
Yeah, I would love it if somebody would share how they make a strong recommendation and the points that they might make when they're talking to a patient. If anybody would be willing to share.
Hi, Kyla. This is Renee. Can you hear me?
Yes, ma'am.
Perfect. So I could share a little bit how I approach it. I try to use motivational interviewing to identify what the true barrier is, and then try to kind of address that barrier. So, for instance, kind of the recommendation might be they might be fearful of the side effect that they heard from from their sister's brother's cousin's hairdresser. And so I identify what the side effect they're concerned with, and then give them the statistics regarding the likelihood, which is usually really small, of that side effect. And so it's really trying to identify what is that, the underlying fear or barrier. And that's with all vaccines, kind of looking at, is it concerns with safety? Is it concerns with efficacy? Is it not feeling that it is efficacy? And so those are some of the concerns. And then another thing I've added that I really like is sharing my personal story. So kind of sharing, I wouldn't recommend it if I didn't feel comfortable, for my family. And so my family has been vaccinated because I've gone through kind of the risks and benefits. And so people feel more comfortable when they know that you've gotten it, your family members have gotten it, and that you feel comfortable enough. More so sometimes than even the statistics. So kind of by sharing some of those experiences.
Thank you for sharing, Renee. That's great.
This is Kirsten Crane. Hi, everyone. Thanks so much for this presentation. What Renee said really resonated, and I was curious I keep hearing, the use of motivational interviewing as a technique to really engage people where they're at around hesitancy. I'm wondering if anybody has seen any scripts or suggested kind of open-ended questions or like some different ways that motivational interviewing conversation might go. So just wondering if that's a resource or if anybody has some favorite questions to kind of get us started.
So that's a wonderful question. Sorry, this is Renee again. I just wanted to say that we're working on developing something like that. I've seen a few that different pharmacy kind of organizations have developed, in which kind of the scripting also looked like the justification. And so we're working on trying to translate that into kind of what words people would be more likely to hear. And so, for instance, if you're talking about like the likelihood of an event happening, and then how do we translate that likelihood using kind of lay terminology to general community of like what would be a comparable risk. And so we've started working on that kind of tool. We've been working on it for a couple months now. And then we're using some of our focus group results to kind of further tailor it with the words that they're using and the ways that they've described it in order to kind of combat some of those issues.
Is that something, Renee, that you would be able to share with the group once you've kind of developed that? Because that sounds like it would be really a good resource.
Oh my gosh, yes. I'd be happy
Okay.
to share it with everybody and then they can tailor it. Like my dream is like that it's in every pharmacy is, as like, hey, it's just something to think about when you're maybe at a loss for words. So in my mind, like the more the merrier and everything's shared kind of across the board.
That's really exciting, Renee. I'm also excited to see that. So whenever you get it ready, if you need somebody to look at it, just to give feedback too, if that allows us a sneak peek, then that would be awesome.
That would be greatly appreciated. I would love that.
In a recent 3D Echo series that Mount Pacific is hosting in partnership with Frontier Psychiatry, Dr. Bob Seiss talked about, we're talking about substance use disorder, but he had this tool and I can't remember what it's called. So if anybody from Mount Pacific remembers what that was called, but essentially it was a conversation with a patient talking about wanting to quit or, seek treatment or seek, trying to stop taking opioids. And it was like a 0 to 10. And the patient said, maybe a 3. And then the follow-up question was, why not a 2? And it was just a really cool way. And I think, you could definitely spin that with vaccine hesitancy, like how likely are you to get the vaccine? 0 to 10, 10 being very likely, 0 like not even interested at all. And it was just a really unique way to be able to gauge what, why didn't they pick a 0? So you kind of understand like there is some motivation in there. So I like the motivational interviewing question, Kirsten.
Yeah, that's great. Thanks for sharing, Alana. And we can also pass along what that tool was from our other project as well, if people are interested.
This is Kirsten. I would love to see that, Kaylin.
You bet. I will make sure I get that sent over. Thanks. Any other questions from the group or sharing you'd like to do?
I think another question would be really how often should that question come up? How often should the vaccine conversation come up with a patient that's hesitant to, or a staff member to get the vaccine? How much is too much?
That's a great question, Alana. I am going to defer to Stevie and Kyla. What do you think would be the appropriate amount of time and how often?
I don't know if there would be an appropriate amount of time, but I think if you could tie it to potentially conversations about maybe managing their diabetes, for example, and then, kind of linking it in when you're talking about other disease states that you're treating, that might be an effective way to kind of approach it, but not just talk about that in it just by itself. I don't know, Stevie, what your thoughts are on that.
And so for patients I don't know well, my first approach is I like to talk about vaccines at every possible patient encounter. I think anytime you're interacting with healthcare is a great time to get a needed preventative vaccine. And usually we've got those in stock. So that's my go-to answer is I would say every time you see a patient, you should talk to them. But once we get to know those patients, if you have somebody who you know that conversation is a little more sensitive, then I like to plan it a little better and make sure it's timely, relevant to their disease state or their personal goals, and back off just a little bit. As a retail pharmacist, we can sometimes see people many times a month, and that can get a little pushy. So I try to be respectful of that. But if you're in a setting where you see people for like an annual exam, or you know that you're going to see them twice a year for their blood pressure check, those interactions hopefully always are including what vaccines have you had and what are you missing, so that we can make sure we're closing the loop to cover people as quickly as we can.
Wonderful. Thank you for sharing, Stevie. I think that's a great approach. Any other questions?
Does anybody have any questions or resources, I guess, for populations of color or indigenous populations? I'm on the distribution list or listserv from National Indian Health Board, sorry. And they have a lot of resources for AIAN populations and COVID-19 and vaccines. So again, too, I just would like to offer that as a resource for anybody that is looking for anything specifically on those populations.
That is really great, Alana. I think we could definitely, in our follow-up pieces that we'll pass out from this, we can definitely send those out to people. It looks as though Renee says she's working to identify elders in the community to be advocates. Absolutely right. I think those are your best spokespeople. Those living in the community, talking to others. Mount Pacific for the COVID-19 vaccine has even started a my why, right? Why am I getting this? And so I think that's a great way to promote and hear it, just like you were saying, share your story. So awesome. Great tactic.
All right. Well, thank you everybody for your feedback and your input. We really value it. We will definitely take back some of these needed materials and make sure we're sharing with the group. And I wanted to give us just a moment before we end here at Quarter Tell to talk about some ways that we can leave this group in action, and changes that we can make today that can really have lasting impact as we move forward. So those pieces will be make sure that you do have those vaccine education materials for those common adult immunizations, especially pneumococcal, COVID-19 right now, and have those available to where people can read them in your waiting room, or you can pull them out of your toolbox for those conversations we have around vaccines. And then look at some of those tools that Kyla had recommended, like the checklist, and different ways that we can engage our adult patients in vaccine conversations. Kyla, I'll pass it back over to you for any final thoughts.
Oh, just thank you so much for your engagement today. And If you have any suggestions for content for us moving forward that we didn't have on our list, please reach out to one of us. And we are still kind of developing content for the last couple episodes in this series. So we're open to suggestions, and thank you so much for attending.
I think we have final polling questions.
Oh, okay.
No, I think we did all of the polling
Okay.
questions.
Sorry, Maynette. Thank you so much for cleaning us up. Thank you, everybody, for attending, and we hope you have a wonderful rest of your Wednesday.
Yes, thanks all.
Bye, everybody.
Have
Yeah,
a great day. Bye.
There will be an evaluation that will pop up at the end. Please be sure and fill those out for us.